Signature Healthcare is a healthcare organization. We operate primarily in the post-acute industry. We've got about 18,000 employees, operate in 10 different states, 115 nursing homes. Most of our business is located in Florida, Georgia, Tennessee, and Kentucky. At Signature Healthcare, much like any other organization that's our size, we're self-funded. In 2016, we had a very abnormal year where we had a huge spike in claims, a lot of very sick patients on the plan. We're a self-insured health plan, and you're going to have those kind of years where I think we probably had a misstep. Was we overcorrected to that bad year, and we drastically increased deductibles, we decreased our co-insurance levels, we drastically increased premiums, and what that did was it priced us out of the market. And in the post-acute industry, it's tough to recruit nurses and CNAs. It's a tough job, it's a tough industry. These people, they live with our residents and they take care of our residents. And these jobs are so vital, and the positions are hard enough to recruit as it is. In 2017, as we noticed that we had probably overcorrected from a plan perspective, we really set out to figure out how do we do something different. We've got to figure out a way to fund an improved health plan while doing it without any money. At first, what we really wanted to do was try and just go at this on our own, create our own network, really cut out the big box insurance company. There's a lack of transparency there that was driving us nuts, that we honestly had no idea where our money was going. Now, where we wound up going is something totally different. The more we researched going out on our own, the more we realized that this concept really already exists. It's called reference-based pricing. And so the more that we dug into reference-based pricing, the more we realized, okay, ELAP is likely going to wind up being a future partner of ours because they're the biggest and the best in this industry. So in 2019, we offered 2 reference-based pricing plans alongside a PPO option. So I didn't want to totally remove the PPO. But what we found was shocking. 75 or 80% of our population walked away from the PPO to a reference-based pricing plan. And honestly, the results have been phenomenal. Savings have been drastic. Employees are happy with their benefits. Deductibles are 20% lower. Premiums are 20% lower. It's allowed us to really market to our competitors, get back in line with our competitors from a market perspective. I mean, in 2019, we saved $11 million. We expect to save even more in 2020, up to probably $17 million. We're taking those savings and we're giving them all back. We have drastically adjusted wage scales, compensation adjustments. We've introduced Uber ride shares to work, daycare subsidies, babysitting services, tuition forgiveness. We're looking at car leases for nursing. We began offering free health insurance this year, which if you'd have talked to me in 2017, I'd have said you were crazy. And ultimately, all of those items, what we've been able to do is package them and market them. And so now our recruiting team is no longer going out and really having to hard source candidates. We've got candidates coming to us, knocking our doors down to come work for us. ELAP allowed us to actually see where we were spending our money. It's crazy to me how as employers, how reckless we are with our dollars. We are spending tens of hundreds of millions of dollars every single year on health insurance that, honestly, we have no idea where it's going. Your big box insurance carriers have contracts with providers. We're not allowed to see those contracts. So we just have to trust that they're competitive. And so what the ELAP model allows us to do is it's full transparency. We now know exactly what we pay providers. We know exactly who has the best quality. Your HR team are always going to be, while they're your advocates and they have your back, they're also going to be the most honest. And give you the brutal truth around things. They have just raved about the customer experience with ELAP and being able to get some things resolved. They reprice claims, but they also are member advocates, and that's really how they separate themselves. And so for my members, it's very easy to get them on the phone, and they're there to comfort. They ultimately, once you call into ELAP, you talk to the same person every single time dealing with your claim. Reference-based pricing is real. We are doing it fully. There is no PPO at our organization. We are competing for high-level professionals. And so from my perspective, CEOs, CFOs, you need to challenge your HR staff just like they need to challenge their brokers to look at this and join the revolution of reference-based pricing with ELAP.